Okay, Mr. Wilton, now that we've done photographs, we've taken x-rays of your mouth, I've probed the gum depths of your teeth, you know, the measurements I was taking, and I'm going to show you what we've collected and explain the style of treatment that I want to perform to get your mouth back into tip-top shape. And this will also help with your bad breath, just getting to the core of the problem. So let's just start by showing you the digital photos that we took when you first came in. So these are the front teeth. You can see along the edges you have some dark areas, and that is just stain that is accumulated over time. So you haven't been in for cleaning in a long time, so you know that soft plaque that you get when you don't brush, if it's not cleaned out properly, it'll eventually harden over time, which makes it very difficult for you to keep clean. So these are flossing zones, which tend to be missed quite often. So if we can up your flossing, that'll definitely help minimize the stain over time. Also down on your back teeth back here, you also have dark stains back here. I will see how much I can get off with my instrumentation, and then we'll reassess later and just see if that is exposing an area of concern that we need to show to the doctor. Here's also the view of your upper teeth, but on the inside that you cannot see through a mirror. So along the gums here, you definitely have the staining. You have some darker zones, but also it shows where the gums have pulled away from the teeth. So that is of concern to me because it means that there's been irritants in there, the bacteria inside the gums along the teeth, that have been in there for a while that the gums don't like, and so they see it as an irritant, they pull away from it, they don't like it, and so eventually they're going to start to pull away. They're a little bit puffy here, which means they have a lot of fluid in there, which is more due to your body forcing the white blood cells and a lot more blood to that site to try to flush it out naturally because it doesn't like it, but it can't flush out that hard deposit, so it just becomes an irritant that it can't get out and it just festers. So when you brush and floss, you might have some bleeding, but that is because your body is just trying to get rid of that irritant. So what I'm gonna do is just take a Cavitron and try to go in there. Cavitron uses high vibration with water, and think of it like a pressure washer on your teeth. So it doesn't only break up all the chunks and stuff, but it also uses the fluid to flush out the bacteria out of there and to give those gums a nice healthy rinse. Now here's the view of your bottom teeth. Here's the lower front teeth on the inside view. You do have the yellowish stuff in here. That is just calculus buildup. So calculus, like I was saying before, is that soft plaque. It has hardened over time and it's just accumulated and slowly built up over time. The more that's around your teeth, the more your gums are not going to like it and they're going to pull away and recede. So we need to really get in there, flush that out, get you all cleaned up, and get your gums back into health. So this is your perio chart. This is what I use to document the gum depths when I was doing the little pokiness around your gums. I was basically using a little ruler to measure the depths of your gums. And we like to see the health of gums would be measured between 1 and 3 millimeters. You do have a lot of 3s, but what concerns me is that there's more 4s, 5s, 6s, and even some 7s. So that just means I really need to get in there and do some deep cleaning. I will use the Cavitron to flush everything out and get everything as good as possible, but I'm also going to come back through with my hand instruments just so I can feel and make sure I get everything properly. Now, because you have the higher numbers in all different sides of your mouth, the best way for me to clean for you is to break this into 4 quadrants. So we're going to start with the quadrant that shows that it needs the most attention, and I will show you more on the radiographs too, but it seems like the lower right quadrant might need a little bit more attention first. So we're going to start down here on the lower right and then move to the lower left, go back to the upper right and the upper left. So let me show you. I just want to use a visual aid to show you kind of the status you're at. So right now, comparing to the pictures that you have, your gums are more like this. You can see the gums are pretty inflamed. They look really irritated down here. There's a lot of buildup, and that just needs to be cleaned off. Once I get to that, give it some time to heal, and you can get to this part. So you can see the gums are a lot healthy. They're less red than over here. They're not as irritated as they were before, and they're just a lot tighter against the teeth themselves, and that is the health that we're trying to get to. When it came to your perio chart, I was explaining that I want gum depths, the probing depths between 1 and 3 millimeters, and that shows health. Right now you're at this status where you have the deeper pockets, so it's just because there's the irritants in there that needs to be cleaned out. So the gums become a lot softer, they are more tender, they bleed more, and it just fills up this gap trying to flush out the bacteria. And so let me do that for you over the course of a couple appointments, and we can hopefully get you back to this healthy state. If you don't come in regularly and we don't quite follow through with what I'm asking, we're kind of at the, so we have health, then you go down to gingivitis, it's just inflamed gums, but you're to the point of periodontitis. So that means the bone is starting to recede. You have a lot of staining in here, and this little yellow spot is the calculus. So it's just showing an irritant under the gums that needs to be cleaned out. If you don't come back to get that cleaned out, it can slowly advance or maybe fast, depends on your health, and it can get to the advanced perio. So you're going to see a lot more gum receding, the more inflamed puffy gums that are going to be super sore, and they are going to bleed a lot more, and it's going to get to the point where your cleanings are going to take a lot longer. It's going to be a lot more painful, but if you can just get to the health point, it'll hopefully get back to what we were talking about before, where it'll be a lot easier to maintain, and it'll be a lot less comfortable, and your breath will be a lot better. Here are the x-rays of your front teeth. We have the upper teeth here, lower teeth down here. It shows great views from your biting surface all the way to the root tips. That way we can check the health of your bone and all your anatomy. And so one thing I am looking for as a hygienist is, so your teeth are supposed to be a smooth transition, smooth line all the way from the biting surface all the way down, whether it has bone around it or not. So you can see there are little bumps, little protrusions out here. That is what we call calculus. So those are the hard mineral buildups that you will not be able to clean off yourself. There's a lot more down here. Just tends to be the zone where all our saliva pools up, which is carrying all the minerals and all the substance that's in your mouth, and it just really sits right in here. So this is going to be the best zone to start in. So let me show you your posterior teeth. Those are the back ones. So this is as if you're looking at yourself. On the left here, this is your right side, and then on the right here, this is your left side. So we do have the deposits up here all the way across, even on your left side. Down on the bottom, there's a lot down in here in between, and a lot back in here too. Another thing I'm looking at are bone levels. So you know how I was talking about your gums were receding? Well, usually gums follow the bone. So healthy bone is usually up at the level at the base of the crown of your teeth. So in the mouth, the crown of your teeth is where the bulb starts to straighten out. And right here, you see these dark lines on the roots? I want the bone level just below those lines. So as you can see, you've lost some bone here, and there's just a few zones that you've lost a little more. So right here, there's a darker spot along the root here. That is where the bone is resorbed. You can also see it right here. So that is an area that I really need to maintain, and we're going to keep an eye on that. Moving down to the bottom, you can also see the bone levels should be up in here. You have lost a couple millimeters of bone. So I really want to focus on the lowers first and really see what kind of cleaning or how in depth it's going to be. And it might even take 2 cleanings to finish the bottom, and depending on the top, I might be able to do it all in one. But we'll just see how it goes as we start the cleaning. Okay, Mr. Wilton, so now that I've shown you the photos, the Paro chart, and the x-rays, just to explain the status of the health that you're in right now, I'm going to explain why I'm proposing the treatment that I believe is going to give you the best outcome to get you back into tip-top dental health shape.